Hi, I'm Dr. Todd Pitts with Summit Brain, Spine, and Orthopedics. A lot of times we get the question of, do I need to see an orthopedic surgeon or a joint surgeon? Am I ready for it? Sometimes when patients get that referral from their primary care provider, they're a little bit nervous of, well, I'm not ready for surgery. Do I need to go see a surgeon? I just want to talk a little bit about that today. The point of getting an orthopedic surgeon involved realistically should be, hopefully if the surgeon's following the right indications, to communicate and educate the patient about, is surgery necessary, and if so, what is it, what's the outcome, and all that going to be. Here at Summit Brain, Spine, and Orthopedics, our focus is conservative management first, and then operative management as the last means necessary. A lot of times when we get those referrals, we do see a lot of patients come in nervous, and when we explain with them that, hey, the goal today actually is not to schedule for surgery, but to do this treatment plan, they're often surprised at why they haven't been scheduled for surgery, both sometimes good and sometimes bad because maybe their hopes were up a little bit. But the thing to understand is that realistically our job as surgeons and physicians in general are to educate patients. And so our goal as you come and see us is to discuss what your condition is, to educate you and teach you so you have a very good understanding of why you have your condition, for example, knee arthritis or hip arthritis, and what the treatment options are and what's going to be best for you. Realistically, surgery's always the right option when nothing else has worked, when conservative management has been exhausted and patients just aren't improving. Oftentimes the three questions I'll ask is, does it wake you up at night, your pain in your hip or your knee? Does it stop you from doing activities that you want to do? And do you have to take medication in order to continue on with your life? Usually if patients answer those three questions yes, oftentimes their joint is bothering them enough that potentially surgery is a good option. Doesn't mean it's the right option, but it's a good option. And then our goal should be in our visits to discuss what is the right option for you at this time. Maybe it's an injection, maybe it's anti-inflammatories, or maybe you are ready for a joint replacement. If that's the case, that's the discussion and decision we get to make together, which is why it's so important at least to create a relationship with your orthopedic surgeon. So maybe you're not being scheduled for surgery, but definitely don't avoid coming because that's not always the potential end game. At most points, it's really just education session so that you can feel empowered with the decision in your care.